Welcome back to the channel. In this video, I'm going to talk about RFK Jr. becoming the HHS Secretary. I'm going to talk about layoffs at the CDC and NIH, and I'm going to talk about some stray comments made by Harold Varmus, the former NCI director, that is disparaging of Jay Bhattacharya. Let's get started. If you're watching on YouTube, this is going to be one long video. If you're watching on Instagram and other platforms like X, I'm going to put it out in clips. Robert F. Kennedy Jr. has become the HHS Secretary. This is an astonishing development. This means so much, I think, for health, public health, and what might come in regulatory science in the years to come. I just want to start by saying it was a close vote, 52 votes in favor. He lost Mitch McConnell. Trump, I think, is saying that that's not a vote against Kennedy, that's a vote against me. That's what Trump says in an interview. But 52 votes, Republicans put him into that position, and he gained no votes from the Democrat side. Right off the bat, I want to say that's surprising to me, actually, because it speaks to how polarized politics has become. Because Robert F. Kennedy Jr. is, spoiler alert, actually a Democrat. I mean, he's somebody who is in the Kennedy family. He is a Democrat. And if you look at his policy positions, historically, they would have been in the Democrat Party. It would have been, perhaps 15 or 20 years ago, a progressive or democratic thing to do to remove dyes and pesticides that are already banned in Europe and Australia and other places. It would have been a Democrat thing to do to sue the companies that make very expensive medical products. That would have been a Democratic position. This has all sort of been put on its head by Donald Trump. He has, I think, to some degree, redefined what the parties mean. And the populist movement in the Republican Party, the fact that Republicans are now the ones critical of the pharmaceutical industry, this is something that didn't exist 10 years ago, and RFK Jr., I think, embodies that. But it's telling to me that people like Fetterman and Sanders and Warren didn't have some common sense and realize that with Robert F. Kennedy Jr. at HHS, they might get more of what they actually want, because I don't think they want the pesticides and the dyes in the food either. They might get more of what they would actually want rather than a standard tried and true politician who usually gets the job. I see Chuck Schumer, the Senate minority leader. He was lamenting the fact that RFK Jr., he's not a pharmaceutical executive. He's never run a drug company. How can he be HHS Secretary? Chuck, you're speaking to the fact that the system is so rotten. The only people who hold this job are complete and total sellouts who are complicit in the day-to-day tragedy, which is the status quo. So you really need to stop talking, Chuck. And you also need to stop making those undercooked hamburgers. All right. So RFK Jr., he's become the HHS Secretary. A while back, someone asked me, you're so tough on Anthony Fauci. Why aren't you equally tough on RFK Jr.? And the answer I gave this person is, Anthony Fauci actually had a leadership position. He actually made decisions from the center of government, and he did some things that were very, very bad. He's at least admitted that he told noble lies. I think that his noble lie narrative is incorrect, and he actually told malicious lies, and those lies were extremely problematic on COVID-19 policy issues. And now increasingly we're learning that he may have been complicit in funding the EcoHealth Alliance grants that funded gain-of-function research in Wuhan that led to the pandemic, and then he covered all that up. So I think there's a lot to be critical of this guy who actually played a role in major events in a government stage and may have killed more people than anyone else in the 21st century. I mean, you have to be critical of that. Okay. But RFK Jr., he's a guy who's always been on the outside of government. He's been a lawyer. He's, to my knowledge, never held any elected office. He's never actually implemented any policies. And so I say that, sure, he may have said some things that I would strongly disagree with, and I fact-checked him twice for publications. He's also said some things that I do agree with and I find provocative and I don't hear anyone else saying. So I'm happy to criticize what he said wrong and what he said right. But the reason I've been a little bit soft on him is that he hasn't had the opportunity to hold an office and actually shape policy like Fauci. But now he does. And so I will judge what he does in that office. This is the most important test. It's not what he said for all these years. It's what is he actually going to do? What is he actually going to do? And let me give some suggestions, okay? You have to go into this and you have to realize, Mr. Kennedy, that you can't win every issue right off the bat. You've got to pick a few issues that are really important, issues where I think you have the public on your side, where you have science on your side, and do something different. I also think, insofar as possible, you need to move decisions into a way in which they will be indisputable, where even your opponents will have to concede to you that you have a point or you had a point. So what does that mean? So one thing I think is low-hanging fruit is obviously food additives and dyes and pesticides that are allowed in the United States that are not allowed in Australia, New Zealand, and the European Union. You can go ahead and ban all of those. And guess what? People will actually like it. Their foods won't be so brightly colored, but I think they'll largely support you. Now, someone said to me, they said that, look, if you get rid of all the dyes from Fruit Loops, it's still going to be unhealthy because it's full of sugars and refined carbohydrates. And I completely agree. You're not solving the health crisis by eliminating these things. However, I recently looked at a bag of bread that was sold at the store, and the list of ingredients was a mile long. I think we truly don't know what would happen if you started to reduce that list of ingredients. We really don't know what would happen to people's health if you really turn bread back into yeast, salt, water, and heat, basic ingredients and flour. If you turned it back to what it's supposed to be, we really don't know. However, I don't think it's going to be the complete story. It may not solve all of human health, and there are other things we need to do. Improve childhood nutrition in school, actually getting people to cook the food in the cafeterias like it once was, rather than having these huge corporate conglomerates sell shitty food to school kids. I think there are other things you're going to need to do, but this is low-hanging fruit. Number 2, the annual COVID-19 vaccine. In this country, the people who ran this policy before, they said that a 6-month-old baby should get an annual COVID-19 booster, and these people added it to the CDC schedule of routine immunizations. Trump has already had an executive order that puts some pressure on universities to remove the COVID-19 vaccine requirement for college students. This is another great place to hit. Here's what you do. 1, that CDC recommendation for all children over 6 months, completely wrong. It has no randomized data to support it. It's completely bogus. It makes no sense in 2025. That needs to be pulled out of there right away. Next thing you need to do, forget about the boosters and vaccine products already on the market. I hear people talk about wanting to remove those from the market. Look, nobody's getting them who doesn't want them right now. What you got to strike is next fall, 2025 fall. Here's what we need to do. Number 1, COVID-19 boosters. They're not going to be available for kids, and they're not going to be available for young people. That makes no sense at all, the risk of that bad outcome in young people. If you're under 50 or under 60, I think there shouldn't even be a booster for you, okay? If you're over 50 or 60, the company can be invited to conduct a randomized controlled trial to show COVID-19 boosters improve clinical endpoints. While they're conducting that trial, perhaps you could provisionally allow the vaccine products to be available for nursing home residents or the few people who actually want them while they're running that trial, but make them run the trial. Here's the key. If the trial is negative, it's going to blow up in their face. And it's going to reveal, I think, the truth, which is that these products, year-over-year boosting, probably has very marginal benefit, if any benefit at all, and has been a waste. If they actually think they can improve outcomes in 18 to 49, go ahead and try to run a randomized trial. Companies, I don't think they'll even do it. They know that that's a bankrupt proposition. They think the probability is very low. That's the next thing you hit. You say, unlike the last administration, we're not giving you unnecessary year-over-year vaccines. And along those lines, read the paper that Mariana Barrosa, John Ioannidis, and I have written on annual vaccines like flu and what we can do there to improve the randomized controlled trial reporting. So that's another place he can strike. Conflict of interest. RFK Jr. should go in right now and take a sledgehammer to the lax conflict of interest policies. If you work in these federal agencies, you can't be on the revolving door, the merry-go-round, where you go into HHS and then you go to pharma and you go back to HHS. Set some clear benchmarks, 1 year, 2 year, 3 year prohibitions, depending on the role, depending on whether or not you're in food or drug products at FDA, depending on what you're doing at HHS, some prohibitions on work in the private sector for the exact same industry you're regulating. I think the public is sick of the swamp. They're sick of the Scott Gottliebs of the world, who was FDA commissioner and then Pfizer board director, and they want some regulation there. CPT codes. The best thing you can do in HHS, the thing that will solve the primary care crisis, that will solve everything, is if you take the reimbursement codes that say a dermatologist seeing people in clinic and taking little shave biopsies should make 2 or 3 times as much money as a primary care doctor or pediatrician working hard in clinic. Those codes determine the fact the derm makes so much more than the pediatrician. And because the derm makes so much more than the pediatrician, all the top students want to be the dermatologist. Okay, that's why the scores are through the roof. They're geniuses. I mean, people going to derm are geniuses. Don't get me wrong, because it's so lucrative per hour. Change the codes. Make the codes reimburse what society benefits from. Primary care, pediatrics, family practice. Turn down the reimbursement on these ultra lucrative niche fields, okay? Turn down the reimbursement. Take those CPT codes away from the AMA, bring them into CMS, revise the codes, make them prioritize societal benefits, and put your earplugs in, because these specialists are going to be crying. They're going to be using their lobbies and cry. You have to ignore that. But if you bend this coding system, and don't even do it drastically, bend it a little bit slowly at first. You bend it a little bit, change the incentives a little bit. Don't let the dermatologist go default on his second house. Change it a little slower. You don't have to cut him off right away. You will change all of healthcare. You will solve the fundamental problem in American medicine, which is that we pay some people way too much and we pay other doctors way too little. You will tackle that. Start with something like that, a small panel of a few things, and then go outward. Vaccine safety. This is the other thing I think you should start with, and I want to mention it. He has been repeatedly saying that vaccines have these adverse safety events, and many of the claims he's made, I think, are not true. However, I think there's a core truth to what he's saying, which is that the current system has no incentive to actually identify all of the adverse events that vaccines cause. There's no mechanism in place. VSD is weak. VAERS, weak. These mechanisms that we have created are so weak that in the pandemic, this country did not detect the myocarditis safety signal from mRNA vaccines, nor did we detect the VIT signal from J&J. We first got notice of both of those things from other countries, and then when we started looking, we said, oh, well, actually, first Rochelle Walensky said, oh, I don't see the signal there. Then she said, oh, my God, it's right there. Oh, how did I miss it? Yeah, sure, Rochelle. That's what our country's been doing. Here's what Kennedy can do. Create a new safety surveillance system. I can give you a lot of technical ideas for how to do it really good, but it's got to be active, not passive. It's got to link people at the moment in which they decide to get the vaccine or not, follow them out in the future. Create this system so robust that even your worst critics, if this machine that you've built to detect safety says this vaccine is linked to Bell's palsy, this vaccine is linked to ringing in the ears, if it says that, you want it to be so scientifically accurate that even your worst critics concede, shit, it's linked to Bell's palsy. It's linked to that. They may try to argue that you should give it anyway. They might try to argue that the safety signal is not worth consideration and the benefit is greater. But at least let's be clear on what the safety is. If Kennedy does this, this will be the greatest achievement, I think, in the vaccine science space. Accurate. People say he should release the data that the CDC has. This data, there's a lot of garbage data that exists. You want to do it right prospectively. And I also think the FDA should be building in better randomized control trial endpoints. For example, if I make an RSV vaccine, the primary endpoint of the study can't be lower respiratory tract infections from RSV. It should be all-cause lower respiratory tract infections. Prove to me that by reducing the burden of RSV, you actually make people better off for the clinical entity or construct, not rather the PCR entity or construct. I think there's a big philosophical difference, and I think the FDA set the bar too low. So, Mr. Kennedy, good luck. I will be following you very closely, and now I think it's all that matters. All the rhetoric for 20 years, you're not in power. Now you're in power. You can make a real difference. And pick a few issues. Don't do everything. The government will resist you at all turns. I mean, turning the federal government is like turning a battleship. Doesn't turn on a dime. Turns very, very slowly. They'll resist you. Pick a few things. Do it in a scientifically rigorous way. Bring on good advisors. Make it so that even your opponents will have to eat their hat. And you will have succeeded, I think. That's what I would do to start. And then there's second order and third order things you can do once you get the momentum going. Okay, the next order of business. The CDC. If you're watching this on Instagram, I'm putting out the clips. If you're watching this on YouTube, it's one long video. The CDC. The CDC has announced layoffs that amount to about, 5 or 10% of the CDC workforce that's being fired. You see, many months ago, I said that I would only be interested in ever working for the CDC if they laid off about a quarter of the people there. So they've only done about half of what I need. So I'm not going to be going to the CDC. But here's what I think. The CDC has done a bad job. We have to be honest about the CDC. They have done a terrible job. We have a paper out called Numerical and Statistical Errors Made by the CDC. We document 10, 15, 20 errors that they have made that are not forgivable errors. They did not even accurately count the number of dead kids in the pandemic. They repeatedly lied and said COVID-19 was a leading cause of death among young children. It never was. They used propaganda rather than science to justify their preconceived policy notions. They recommended that 2-year-old babies should wear cloth masks for 10 hours a day in daycare, except for the 2 hours a day where they all lay next to each other and take a nap. These are not brainiacs who come up with these kinds of broken, moronic policies. They set 6 feet of social distancing, even though that crippled schools and punished a generation of kids and kept them out of school. There are a lot of people at the CDC who are incompetent. Okay, in a perfect world, you'd somehow go through the bureaucracy of the CDC, the tens of thousands of employees, the 40,000 employees, and you find the 10,000 worst performers and you get rid of them. Unfortunately, that's not what this administration has done. They've not done that. They've just fired, 10%. It's hard to know exactly who they fired. Now, some people say that that's not a surgical strike. It may be firing some good people too. I think there's some truth to that, but the reality is it's very difficult to find the worst 10 or 20%. They're very difficult. They're hiding. They're hiding in the CDC. And when major companies fire huge chunks of their workforce, a few years ago, Meta, Facebook fired 11% of their workforce, the newspapers don't say Meta gutting the engine of prosperity that made Meta great. No, they say Meta is undergoing a corporate restructuring and they probably will emerge more lean. Similarly, I think even if you do fire at random, you will make your organization more lean. You'll lose some good people, but perhaps you can hire back the good people and you've lost the bloated bureaucracy. CDC, NIH, federal agencies, they have a lot of bloated bureaucracy, just like Google and Meta did before they underwent restructuring. The media is covering this like it's a bloodbath among scientists. It's not. It's people losing a job that wasn't guaranteed to you by God, okay? There's no guarantee you should get a federal job and a federal pension and get to sit around all day at home on Zoom drinking coffee and going to a few meetings. There's no guarantee of that. You can lose those jobs. Those jobs should be lost. I would like to do it more targetedly, but a little bit at random is probably also better than the status quo, which is just paying people's salaries. One more point. I sometimes hear people say that even you do all these cuts and cuts and cuts, and it's just less than 1/10 of 1%, half of 1% of federal spending. It's not going to be a big chunk in federal spending. Sure, but it's still billions or hundreds of billions of dollars. We don't want to save hundreds of billions of dollars. We should save money. This is public money. It doesn't matter if it's 1%. It's 1% because the whole pie is so big, but it's still worth saving. So my sympathy for the CDC is low. Now, somebody said that, well, one of the things the CDC cut is the investigative branch, the EIS service officers that go and investigate epidemics and say, oh my God, it was actually the shellfish over there. It was the tuna salad that actually got everyone sick. And that is a useful service in many cases because it helps you identify the culprit thing and prevent more people from being sick. But they give anecdotes to justify the EIS. But anecdotes to me don't justify the EIS. Like, sure, I'm sure you once found the culprit shellfish and it probably saved a few cases. But in aggregate, does the EIS do a good job? And do they do it at value for money? What's the cost effectiveness of having the EIS service? I don't know the answer to the question. I saw someone say, how to say on Twitter, that remember how Kate Winslet in the movie Contagion flew into harm's way to stop the virus? That's what the EIS does every day. I said, really? Just like Kate Winslet did? I was like, where the hell was Kate Winslet when the infected employee of the Wuhan Institute of Virology walked out coughing? I guess she wasn't right there on the plane. Okay, she wasn't there to help out. That would have been a good one to help out, to catch Kate. Sorry, you're working on your other roles. I think it's a little ridiculous when you start to use fictional characters to justify the value of a job. I mean, it would be good to use an actual person who did the job, but that's just me. So my overall take on the federal government layoffs is there's a lot of fat. It is difficult to cut all the fat. If they cut it random, they're probably going to cut some useful parts, but they can try to re-add those back later. And in corporate world, this would be what happens all the time. You think corporate measures of productivity are a gold standard? They also have flaws. And so I'm not too scared about that. I do think the reaction is a bit of the Trump derangement syndrome, which pervades the academy, and it's one of the core problems that we're going to come to in the third point of this video. Harold Varmus, good old Harold Varmus, the discoverer of oncogenes, RAS, the fact that oncogenes live inside us. He's the Nobel Prize winner. He was the NIH director, I think under Clinton. He was the NCI director when I worked at the NCI. He's come out with an op-ed in the New York Times, the ripe old age of 85, which is critical of many things. But one of the things he said was that Jay Bhattacharya is wrong. He said Jay Bhattacharya, of course, is a health economist. And then he said Jay Bhattacharya is going in there with grievances. He has no evidence to support that. And then he said that Jay Bhattacharya wants to reduce NIH spending on universities that don't abide by academic freedom. And he called that proposal outlandish. I want to address that claim. Is Jay Bhattacharya going to do this? I don't know. But if he were to do it, is it outlandish? So first, we got to back up. What is academic freedom? Academic freedom is the principle that university faculty who've attained a certain amount of, I think, accomplishment should be allowed wide latitude in their thinking and thoughts and speech to keep the Overton window wide on what they're allowed to say without fear of reprisal. Not because every bold thought they have is going to be good. In fact, most bold thoughts they have will be crazy, for sure. But because some of the bold thoughts might be truly revolutionary thoughts that no one else is having and that are taboo. And that if we deprive them of the opportunity to have this full range of thinking, we deprive all of us of the best ideas, not the worst ideas. That's the idea of academic freedom. I think there's two senses of academic freedom. I think there's active and passive academic freedom. Let's do passive first. Passive means universities should not punish doctors or faculty or professors who have views outside the quote-unquote accepted canon. They shouldn't punish you for your ideas. They violated that in the pandemic. Bob Harrington, who was the chair at Stanford, now the dean at Cornell, he famously told Eran Ben David, who was a critic of lockdowns, stop talking to the media. And Eran did stop. He got promoted, but Eran did stop. He put pressure on him to silence that point of view. That was a violation of academic freedom. Eran Ben David is an ID doctor, an expert on, I think, thinking about the multifaceted repercussions of health policies, and he was silenced by his chair because the chair was worried about maybe the NIH grants that are going to be cut off because he was going against Fauci or all the other sort of stupid things the chair might be worried about. That was a violation. Scott Atlas was a radiologist at Stanford. He was picked by Trump. He goes on stage with Trump. He says, there's no evidence that kids should wear masks. In fact, there's no evidence that any of us should be wearing community masks. And in fact, schools should not have closed. That's what Scott Atlas said. And they should reopen as quickly as possible. And the academic community at Stanford actually issued him a censure. They censured him for those comments. A censure that they did not even repeal when they had the opportunity a year ago. Stanford does not allow academic freedom. It censored him. Okay. Another example I can think of pre-pandemic is Norman Wang. He's an electrophysiologist at the University of Pittsburgh. He wrote an article in the Journal of the American Heart Association, the premier journal, that said affirmative action is probably misguided. It probably doesn't actually achieve the stated goals. It has a backlash against it. It actually has some mismatch between, I think, the applicants and the tasks of the job, and we should rethink it in cardiology. Then, of course, there was a big mob on Twitter that got him, and they got him real good, and they got him canned as the fellowship director of EP, and they put him through hell there at his job. They punished him for having a view that, ironically, the Supreme Court later said, actually, Norman Wang, everything you're saying is actually 100% correct. We actually agree with you completely. They went after him for having a probably right-of-center conservative point of view on affirmative action, but probably a point of view that probably 60% of Americans actually share, to be honest with you. That was bad. It's very, very bad to have punishments for people who hold views that, in these cases, actually probably the majority of Americans hold, but certainly that are well within the canon of acceptable views and acceptable policies, that are not illegal, that are not calls for violence. These are perfectly reasonable views for people to hold, and universities punish faculty, which sends a chilling message to the academy, is a huge violation of passive academic freedom. There's an organization called FIRE that ranks universities based on their commitment to free expression. And Jay Bhattacharya has a proposal, I think that's been discussed, gossiped about, that FIRE rankings would help the NIH decide which universities should preferentially get funding. Before I talk about that, let me just say about active academic freedom. What is active academic freedom? Active academic freedom is what universities really should be doing, which is they should be having debates on important policy issues. They should actually have said during school closure, we're going to bring a panel of 3 people in favor of it, 3 people opposed to it, and we're going to televise this for the public. They should have had debates on masking kids. They should have had debates on vaccine mandates. They should have debated these things because these are extremely debatable and many faculty disagreed. That is the commitment to active academic freedom. Universities completely abandoned that. They ceded that role to Joe Rogan. They ceded that role to podcasters. They ask themselves why they're increasingly culturally irrelevant, why they're targeted by politicians. It's because they have abdicated the most important thing they had, which was being a forum for debate and dialogue in a society. They have failed profoundly the social contract. And so, to some degree, I like to see them get punished for it. But they did fail. Now, the NIH. If you receive federal funds, you have to abide by Title IX, which means you can't allow discrimination on the basis of sex. If you receive federal funds and federal grants, they consider the fact that is the university a good place for you to do the research? Do they have the bench space, the lights, the computers, the staff to work with to get the research done? They consider these things already. Why shouldn't they also consider the intellectual environment? Why shouldn't they also consider whether or not you have a commitment to academic freedom, whether or not you allow your faculty to probe the range of ideas that are possible, to not be restricted or self-censor because they're worried about some scold in the dean's office? And, we have to be honest about the universities are mostly progressive institutions. It's mostly a problem on the progressive side. There are a few conservative places where they'll censor you the opposite way, but mostly it's a problem on the left because the left's in charge of most universities. That's the reality. Why should public money be given to places that don't guarantee academic freedom? Just like why should public money go to an all-boys club? It shouldn't. So why should public money, that's Title IX, why should public money go to a club that doesn't allow you to speak freely about masks and lockdown? Why should you get, and I'm not saying it should be absolute, it should be like a dial switch, that we could use some modified fire ranking and you should get a little bit of incentive if you're at a school that promotes academic freedom. Why is this important? If Jay does this, universities will turn around tomorrow. You see what what happens to them when you threaten their funding. They cry, they beg, they plead, they sue. They'll do anything for those NIH dollars, and they too will give academic freedom if they are incentivized to do so. And that is something that's very important and very useful. Harold Varmus, completely off the mark. He calls it outlandish. It would be like Harold Varmus in the 1970s would say it's outlandish to demand universities treat women the same. I mean, that's the same antiquated view. There's nothing outlandish about it. Title IX works, and this will work too. Rankings for academic freedom. And in fact, the NIH could even have a hotline where they solicit anecdotal stories of what happened to faculty who did go against the grain. And I'm sure they're going to get a lot of things out of the woodwork because I get a lot of things. I get hundreds of emails sent to me from faculty about what reprimands they faced for merely going against the Fauci lore, the Anthony Fauci bobblehead doll. All right. So those are my thoughts. RFK Jr., HHS Secretary, depends on what he does. The CDC laying off lots of employees. It's just a restructuring. Hopefully they'll emerge stronger. And Harold Varmus, completely wrong about Jay Bhattacharya and fundamentally wrong about the virtues and values of free expression in a free society. And so I like this format. Uncut, you see? Uncut. An uncut video where you discuss many topical issues, and I'll put the clips out separately. If you're watching on YouTube, it'll be one continuous video. I'll be back with more videos in the weeks to come. In the meantime, you should go to www.drvinayprasad.com. Become a subscriber in my Substack. I think that's the best way to follow me. You should follow me on X or Instagram. I think Zuckerberg has actually turned down the censorship at Instagram, and actually my videos are reaching a further audience. I'm a little worried about YouTube, to be honest with you. I wonder if they've down-throttled these videos, because sometimes I think the video would be even more popular if people were allowed to have free access to it. And if I see that CDC banner one more goddamn time below my video that says, actually, if you have questions about public health, click on the CDC. Hell no. The last place I'd want to read about public health is the CDC after they've betrayed Americans so badly in this pandemic. I'd want to read it myself. So put the links to the primary study materials, okay? If you really want to put some links down below. But I wouldn't trust the CDC blindly. All right. If you like this video, you know what to do. Like, subscribe, comment, leave a message below. I'll be back with more videos, and until next time.